Hello, everyone, and thank you so much for joining us tonight for our first live workout. I'm Teresa Blondin, the Director of Volunteers and Programs at Bladder Cancer Canada, and we're thrilled to be hosting this session, and we can't wait to get moving with you. Exercise is so important, and these workouts are especially designed for people affected by bladder cancer, whether you're preparing for surgery, recovering, or simply looking to stay active and support your overall well-being. So get into some comfy clothes, grab your water, maybe a mat, and we will get started. So the exercises we'll go over tonight are featured in our Healthy Living Guidebook, and they were created by our presenter this evening, Amy Sweeney. Amy will break down these moves in lots of detail, but during the workout, if you have any questions about any of the moves, please enter your questions in the chat. We'll take our time with each of the moves and make sure you feel comfortable with these exercises, and there will be time for a Q&A after the session as well. So now to introduce our host, kinesiologist and owner of Kinnect Active Rehab in North Vancouver. Amy has her bachelor's of kinesiology from the University of British Columbia. After having a personal experience with recovering from injuries, Amy followed the path of rehabilitation to help people so they too could get back to doing the things they love. Amy gained a special interest in pelvic floor corrective exercise after having her daughter Dylan in 2020, as well as cancer exercise after losing her best friend to the disease in 2010. Amy, thank you so much for being here tonight, and I will pass it over to you.
Hi, thank you for having me tonight. So as mentioned, we're just going to kind of run through the exercises that I created on the program. This program is created for people, as mentioned, when you're getting ready for surgery, as well as after surgery, and you're starting to kind of reconnect with your bladder and the pelvic floor and getting things moving again. So this isn't kind of your overall exercise program for day to day, but I do plan on kind of touching base on that after we get these exercises going. So we can get started right away with breathing. So I'm going to move this down, and please let me know if you can't hear me or if it's hard to see. There we go. And what we're going to start with is called umbrella breathing, 360 breathing, even diaphragmatic breathing. This is going to help you connect with your pelvic floor and your core. And it's really important that we connect with our deep core and not just our outer layer of our abdominals. So what we're going to do is you're just going to come lie on your back, knees bent to help create a more neutral pelvis. Versus if your legs are straight, you might find that your back comes off the ground a lot more. Now, if this is uncomfortable for you, you can't feel free to place a towel underneath your back, behind your head, any sort of pillows underneath your legs so they can relax more. The more comfortable you can be in this position, the better. And what we're going to do is you're going to take a big, deep inhale through the nose, filling up your filling up your lungs from bottom all the way to the top. And when we say 360, I want you to think we're not just breathing into the belly, we're not breathing into the chest. We're actually focusing on belly, the ribs, and our back. So you're breathing down into the pelvic floor, filling that whole kind of trunk, you could say. So it's again, belly, ribs, and back. And as you breathe out through the mouth, we're going to pull up your pelvic floor. Imagine that as you're pulling up your pelvic floor, you're also starting to try to bring your hip bones towards one another, and that's going to help you engage your lower abdominals. Now, when we talk about the pelvic floor, for women, you want to think about pulling up the vaginal wall, the urethra, so as if you're holding in a pee, as well as the anus as if you're holding in a fart. So there's 3 places you need to think about when you're engaging your pelvic floor. For men, think more pulling the boys up, holding in a pee, as well as holding in a fart. And then we're bringing in that rib cage, sorry, not rib cage, we're bringing in those hip bones towards one another into the center. And then we're meeting as you're exhaling as well. We're kind of bringing in that center core as well, as if you have a core set tightening up. So we're gonna do those breaths a couple times because I know that's a lot of information. So you're gonna take a deep breath in through the nose, filling up all 360. And then as we begin to exhale, you pull up the pelvic floor in those 3 points. Tap the hip bones, or imagine to tap those hip bones. And as if you're bringing in a core set at that center. So I want you to give those a few times, cycle through that a few times. And if you have a couple of questions, feel free, and I can hopefully clarify that for you. Now, if you notice that your upper back or your rib cage is sort of flaring up, when you exhale, at the very end of the exhale, you could also bring a little bit of upper abdominal engagement, trying to bring those rib cage down and in. And that's a really nice way to start engaging and connecting with your core before you move in to the rest of your pelvic floor and core exercises. So the next one I have on the exercise program is bridges with adduction. So this one we can kind of break down into a few pieces. So what you'll first do is you want a small ball, and you're going to place it in between your thighs. I don't want it right, so I'll show you this. I don't want it right at the knees because that's going to kind of get more the knees working. We want it a little bit lower so that you get your inner thighs, your adductors working harder. And we're going to kind of implement that breathing again. So as you breathe in, you're kind of in a more release, relaxed position. And as you breathe out, I want you to first just try the adduction. So using your inner thighs, you're going to squeeze the ball. So even if you don't feel the adductors, place your hands in your inner thighs, feel the hardening of the muscle to help you realize if it's engaging. The next thing I want you to do is also feel kind of in your hips, those hip flexors and your glutes, to make sure that they're not engaging when you do that adduction squeeze. We just want to connect with those inner thighs. From there, we can take a deep inhale and release that squeeze, but not too far that you drop the ball. And as you exhale, we're going to squeeze that ball. And now you're going to engage your glutes, driving your hips up into the air, managing to still keep that pelvic floor and core engaged. And then as you inhale, you can release the glute and the core. And as you exhale, we engage the core, squeeze that ball, and drive the hips up into the air. Now, what I want you to watch for here is sometimes we tend to want to lift more from the back, and we kind of go into an arching of the back. So I want to make sure that core is nice and strong. And this movement is driving the hips up is coming from those glutes. The next thing I want you to check in on is when you're up top, what is happening in those quads and in the back. So a lot of times we tend to push away, putting a lot of pressure on our shoulders, and our quads are working harder. So I want you to imagine that core is engaged and that you're trying to drive your heels closer to your bum and your knees over your toe. So see how my weight shifts over a little bit. That takes pressure off of my shoulders and off of my neck. It also fires up my glutes and my hamstrings more, taking less and more of a stretch in the quads and taking the work out of the quads. As we inhale, we come down. And as we exhale, we engage that pelvic floor and that core, and we drive back up. Now, no, again, this is a lot to learn and reconnect with. So take your time. And if you don't feel that core connection right away, that is okay. We just take our time to kind of reconnect, and we don't need to do 2 sets of 10, boom, boom, boom. You can take breaks in between, reset, reconnect, and go again. Now, the next one I have is called Rockbacks. Now, this is for people who have found that they're really lacking in the glutes, and you kind of sit in this position. So you come onto all fours, wrists under your shoulders, and hips right above your knees. You're going to take a deep inhale through the nose. And as you breathe out, we're going to let your hips drop back towards your heels, really trying to focus on lengthening here in your glutes and in your back. So when I say that, what I mean is we don't want to see you rounding kind of into that cat position. We're trying to keep ourselves into a neutral pelvis. So you take a deep breath in, rock back. And as you exhale, we come back to all fours. Now, if you are someone who wants a little bit more of a core challenge, you can bring your knees back a little bit. So as you rock back, taking that inhale and lengthening the glutes, keeping a nice long spine, we're going to engage and meet our shoulders back over onto our wrists. Deep breath in and out. Now with this one, you might feel a little bit of a challenge. So again, you don't need to go all the way back. You can work in small movements and work your way up to more of getting into that modified plank position where you should feel your core engaged. Now, the next one I have is the bird dogs. And this one is a slide motion. So we can work our way up, and I will show you both on how to do it. So you're going to take a deep inhale through the nose in that all fours position. Again, shoulders over wrists and hips over knees. As you exhale through the nose, we're going to engage that pelvic floor and that core, and you're going to slide a hand and the opposite leg back and in front of you. From here, you're really trying to focus on keeping your hips square with one another. So we're trying not to lean too past your left knee and lifting up the opposite leg. We also don't want to see a drop. We're trying to stay nice and still here. Now, if this is a challenge for you, you can just slide a hand and back, or a leg and back. You can alternate or do one side at a time. Another option, if that's now too easy for you, is you take a deep breath in, and as you exhale and engage the core, you lift the arm up and the leg goes back. Now, when you are kind of reconnecting with your breathing, if you find that it is easier to do the whole motion through your exhale, you can do that. And then take an inhale at your rest. Another option is that as you're doing the work, you exhale, and then as you're coming back to rest, you inhale. Mm-hmm. And please let me know if I'm going too fast. I know I might be speeding through this a little bit too quick.
We had one question, Amy.
Yes.
For bridges with the adduction state, hold for the required time. How long do you recommend holding each bridge?
So depending on what you're looking for, there's benefits to both. Typically, I say like I do a count of about 2 to 3 going up, hold for a count of 2 on the top, and then a count of 2 to 3 back down. Now, there's also benefit of holding it at an isometric hold at the top, so you can challenge yourself to see how long you can hold it, but it challenges your muscles in two different ways. So to begin with, I would typically suggest about 2 to 3 seconds, as what we're really trying to work is the muscles through their full lengthening and their full contraction. So when we just hold it from the top, you're only really strengthening it at that contraction position.
Okay, thank you.
Does that help? Yeah, right. All right. So then the next exercise is the supine pelvic tilts. This is a really important one as well to help make sure that you get mobility in your pelvis, because oftentimes we can kind of get stuck, be it in an anterior pelvic tilt or a posterior pelvic tilt. So this one is a really gentle exercise. Again, if you're lying on your back, feel free to meet yourself with where you're at. So add any props that allows you to be the most comfortable that you need to be. So with this one, as you take a deep inhale in, this time, unlike the 360 breathing, you're actually going to allow your back to kind of come off of the ground and arch up as you go into a bit of an anterior pelvic tilt. So you're kind of bringing your hip bones towards your thighs. And that's during your inhale. And pelvic floor is nice and released. And as you exhale, you're going to engage your pelvic floor. And this time, you're going to rock your pelvis, rotating it back almost as if you're trying to bring your hip bones towards your head, flattening your back on the ground. So this, you should feel a little engagement in the pelvic floor and the lower core, as if you're doing a little tiny baby crunch. And as you inhale, everything releases. And you arch that back again. And as you exhale, we flatten. Now, when you're doing this, I really want the focus to be just the core. So in other words, I don't want you to feel like you're using your bum or your legs to kind of help you do this movement super easy. We really want it to be a small, gentle movement and really pelvis focused and led. So we'll give you some time to do those if you're trying these out. So we take that deep inhale. And as you exhale, we do that pelvic floor engagement, lower core, kind of baby crunch, flattening that back on the ground. Take an inhale and an exhale. Now, for all of these exercises, as I was kind of mentioning with the bridges, is you kind of want to take everything slow. So typically a 2 to 3 count through every single movement will help you stay at a steady pace, because we tend to want to use momentum and speed through exercises, especially when we want to get something done. These exercises can sometimes be a little boring, so we speed through them. So counting a slow 1, 2, 3 can help kind of slow it down and make sure that you're getting the benefit of engaging that muscle through its entire length and range of motion, instead of bypassing where we may have some weaknesses, which we tend to miss out on when we are moving quickly through the movement. Now, the next one is a supine marching. So again, just like the other ones, there is a little bit of progression in this one. So if you are a beginner and you need to keep it simple, we can do that. And I can give you ones that are more difficult for someone who is able to do a little bit more. So what we're going to do on this one is we're going to take that deep inhale through the nose. And as you exhale, as someone who's a beginner, you can just lift your toes off the ground. And what you're going to feel is that your pelvis kind of wants to shift. It wants to shift to the side to kind of compensate for those toes leaving the ground. And then as we inhale, we just let those toes go down. So we're really trying to keep our core strong, to keep our pelvis as neutral and as still as possible, and not letting it shift side to side. Now, if that's fairly easy for you, the next one you would do is take Deep inhale through the nose. And as you exhale, we lift the leg up. Now, right now, you want to keep a 90 degrees because that keeps the hip flexor out of it a lot more than if we're straight, considering that increases your lever. And then there's a lot more work being asked from your core and your leg. So we're going to come here. And as you inhale, the leg goes back down. Now, again, with your breathing, you can inhale when you're at rest and exhale through the entire motion, or you exhale when you come up and inhale as you come back down. You'll alternate legs, or you can do one leg at a time, depending on what feels best for you. And if that's fairly easy, the next step would be taking a deep breath in. And as you breathe out and engage the core, we lift one leg up to 90, and then you pop that other foot off the ground, really watching for that back wanting to come off the ground. So really try to keep the core nice and tight. Foot comes down. The other one needs to take a deep breath in, lift the leg, and the other one pops up. And then back down. Deep breath in. And exhale. Engage the core, lift the leg, other one follows. So that one, there's tons of ways to kind of make it more challenging or easy. My biggest rule of thumb in terms of, we kind of talk about these, is a pain is a huge factor in how we do these exercises. If you notice your tolerance or pain is quite high, like not your tolerance, but your pain is quite high, we can adjust that by either modifying the movement. So you move through a lesser range of motion, you decrease the amount of sets or reps that you do, or we just completely modify the exercise as a whole if that exercise is not right for you. But in terms of all these exercises, typically 2 to 3 sets of, we tend to want to do more moderate. So you're looking at anywhere between 10 to 12. If you can comfortably do 2 sets of 10 to 12, then we want to make sure that you're increasing the difficulty, okay? Now, the last 2 we're gonna do is a fire hydrant and then a bear lift with a knee hover. So a fire hydrant, we're kind of back into that all fours position. And as we take that deep inhale, we're nice and relaxed. And as we exhale and engage the core, we're going to bring one leg out to the side at 90 degrees. Again, doing our best to keep our hips square. And sorry, I don't mean 90 degrees like you bring your leg all the way out. I mean keeping your knee bent at 90 degrees and keeping the angle at your hip from your body to your knee is at a 90 degree. For beginners, it's okay if the toes stay attached and we're just working on lifting that knee and maybe moving just an inch or 2 out. So we take that deep breath in. As we breathe out and engage the core, we bring that knee out and we come back in, take a deep breath. And as we breathe out, we engage the core, take that knee out. Now, if that's a little bit easy for you, then we take that deep breath in, we breathe out, and you bring that leg out to about 45 degrees if you can. Again, we're trying to keep hips stable. We're watching for leaning the standing leg too far beyond, so I can probably show you from this angle here, that we don't want to kind of lean like this, where now my hip is way past my knee. We kind of want to keep our hip above our knee here. So the work is really in the core. You're also going to feel this in the hip. Again, if that's even easy for you, simple way of making it harder is just adding a band to the thighs, and then you have a little bit of a resistance to go against. And then the last exercise is a bear lift with a knee hover. So we're again going to add that adduction in this one. This helps you access your pelvic floor and your lower core a little bit better than it would so we're on all fours. Take a deep breath in through the nose. As we breathe out, we're gonna squeeze the ball between those thighs. Tuck your toes. You can't see my toes, sorry. Tuck your toes underneath. And as you're squeezing that ball and exhaling, you're gonna lift your knees off the ground, trying to stay in that position. Now, this one's a pretty difficult one. So an easy way to modify is to put your arms up on a bench or a couch to change the angle. You also don't need to do the knee hover right away. You can work your way up to that. So just starting to initiate the movement of lifting the knees off the ground and coming back down. So I know I feel like I kind of rushed through all of that. Sorry, but is there any questions or concerns about those exercises, or want me to go through one over again?
There was a question about the size of that ball. Is it about 12 inches in diameter?
Yes. So this ball is a Pilates ball. So you can pretty much find it anywhere in any store. I think it's about 8. Of course, this one doesn't have it, but I believe it's about 8 inches sort of ball. It's fairly small, very, very squishy. If you look up Pilates ball, you should find it pretty much anywhere.
Okay, perfect. Well, thank you so much. So yes, please, if you have any questions about those activities, please put them in the chat and we can go through some questions. If you don't have a ball, is there anything else someone could use?
Yeah, a towel, a pillow, pretty much anything that isn't just like super hard. It gives a little bit of feedback just to allow your muscles to, have a little give, but pretty much you can work with anything at home. So typically towel and a pillow are the best options. Just roll them up.
Okay, great. And someone asked if you could go over that last exercise one more time.
Yes, of course. All right. So you're on all fours, toes tucked under with your hips over your knees and your shoulders over your wrists. You're going to take a deep breath in through the nose. And as you breathe out, you're going to engage the core, squeeze the thighs, and just lift the knees an inch or two off of the ground. So you almost kind of want your shins parallel with the ground. And then you're going to come back down. Now, you can do this as a isometric hold. You can hold this for 30, 45 seconds to really challenge your core. Or at the beginning, work your way up. So it's just come up, hold for a count of 1 or 2, come back down, reset. Biggest thing from here is what we typically see is when people go up, they want to straighten their knees and almost kind of go into a downward facing dog. You want to do your best to keep your knees at a 90-degree angle. Your hips are just kind of floating up, staying 90 as well. They're not you're not changing your angle.
Okay, great. Thank you for showing that again. And then 2 questions about hernias. So one, do you have any recommendations to exercise your abdomen and not cause a hernia when you have a stoma?
So with that one, I would say the physios might be able to address that a little bit better than I do. It's not out of my scope of practice, but teetering with it. Typically with people who have hernias, it's very, very important to work on your pelvic floor and your core. Now, with that being said, it's really about learning to connect with that deep core. So a lot of these exercises, that's exactly what these exercises are for. I would just say be very aware of when you kind of go into what we kind of call like refrigerator core or bracing core, where like you're almost kind of bracing to get punched in the stomach.
that's going to kind of promote your abdominals abdominals when you engage them. They're going to kind of push out away from you versus kind of flattening and coming inwards. When they push out, that's where you're going to see the effect on the hernia, because that's really, it's the muscles going through another set of tissue put to kind of stick out, right? So you want to, all these exercises, as long as you feel like you can connect with them, they should be helpful. If anything, you feel like they are creating that kind of bracing core and you're noticing any sort of bulging happening in your hernia area, I would suggest maybe taking a step back and trying to, again, like I was saying before, that modifying the exercise to allow you to really connect with your core so that you are hopefully able to strengthen that muscle and reduce the hernia and the stoma versus making it worse, which is not what we want to do.
Perfect. Okay, thank you. And if someone is having difficulty feeling their pelvic floor to do the exercises, what would you recommend to kind of connect with that?
So the biggest one for that is keep practicing. I kind of explain that a lot of us are disconnected from our pelvic floor, and it's almost like dial up is how I explain it to clients. Is it's a very weak connection from brain to the body. The more you use it, the stronger that connection gets, and then you will start to feel it. There are little tips and tricks to engage with each portion a little bit better, such as if you're actually sitting down and to connect with, say, more the back of your pelvic floor, you can actually lean back onto more of your tailbone and engage, and you will be able to feel kind of the anus engage a lot more compared to the front of your pelvic floor. And the same as if you sit more forward onto the front of your pubic bone, you'll feel more of the front of your pelvic floor. But the biggest thing is practice, practice, practice. Take your time, and that connection will eventually get stronger.
Okay, great. And would you say these exercises you showed today are good prehab for a hysterectomy?
Yes. Yes. So these exercises, so I actually had, which is how I kind of initially got connected here years ago. I had a client who I did these with. He had bladder cancer. He was preparing for surgery, and he was told he'd have his catheter in for a few weeks, and he ended up only having it in for 5 days because he did these exercises prehab. And so as soon as post surgery, he'd already created those connections. And so as he started to do those exercises and connect to them, he was able to kind of get the okay to move forward. Now, I'm not saying that's what's going to happen for everyone, but there's a lot of research out there showing that the more you practice these exercises and connect with your pelvic floor, the quicker and the better your recovery will be. So it definitely will benefit if you do these beforehand.
Great. Okay, and most of the ones you showed today are to help the pelvic floor, but also the abdominal wall?
Yes.
So, okay, that was a question. These are kind of the gentle abdominal exercises.
Yeah, I would say they're the kind of the general to reconnect with our deep core, which I would say just in society in general, we're a little disconnected from our deep core. And the pelvic floor and the core are connected. And so when we have one that's affected, the other one will be affected as well. So these are specific to pelvic, like to reconnecting to your pelvic floor, but also to your deep core to give you a stronger foundation to get back to everyday life. And with the minimal effects of kind of falling back or injury, if you are someone who works out on a regular basis or just, cleaning your house, cooking dinner, things like that, like it's prevents injuries.
Yeah, absolutely. Okay, great. And then not sure if you would know this one, but there were some questions about reducing the side effects of treatments such as BCG, or if it was okay to do these exercises when receiving BCG. So, not sure if you know that one,
Yes.
but
Yes. So I do have some information on this. Actually, I kind of prepared to talk about this sort of stuff. So if you want more detail, because obviously we don't have a ton of information, there is, or time, sorry. There is a podcast called Found My Fitness, and it's by Dr. Rhonda Kirkpatrick, and she specifically interviews Dr. Carrie Kearney, who works out of Alberta and is specific on cancer and exercise. And so all the research coming out now is showing how important exercise is during treatment. The biggest takeaway is it can help the people. They did research and showed that people who exercised during treatment reported less fatigue than those who rested. And there's also research showing that during treatment, when you exercise, because it gets the heart rate moving and blood flowing, it actually helps the delivery of treatment to be more effective because our muscles and our body is ready to and more available to receive and take in that treatment. It also, not necessarily treatment focused, but it also helps with reducing metastasizing because as with our cells, the cancer cells are very, they're kind of weak and weird and all this sort of stuff. And so when we get the blood flowing, it's easy for our blood to actually abolish it. It's explained a lot better in the podcast. But if you want some information on that, that's a really good podcast. It's about an hour and 40 minutes long, and they kind of talk about a lot of stuff. But the main takeaway is this stuff is more focused for recovery from surgery and getting the body moving, some basics exercises. And then once you're kind of more into the treatment phase or kind of more just everyday life and trying to exercise again, it is better to focus more on aerobic exercises. Yes, sorry, I saw the question there. I can provide you with the link for the podcast so that you can pass it on to everyone. But it's important to focus on aerobic between moderate to vigorous exercise. So about 75% of your maximum heart rate. It can be walking. Just make sure that you're walking fast enough to increase your heart rate. Research is showing 150 minutes to 30 minutes, 300 minutes a week is the best. Anything past 300 is still better. They kind of say the more the better in terms of cancer and exercise, but you start to plateau at 300. So don't feel like you have to fit a ton in all the time. The other information that they kind of share is that it's better to kind of fit in every day a few minutes of exercise, even if it's 10 to 15 minute spurts here and there, and getting your heart rate up. Because again, it's more about the acute effect of exercise on the cancer cells versus this like, oh, I'm just going to fit in 150 minutes of exercise in my weekend. It doesn't mean you need to exercise 45 minutes to an hour every single day at 1 minute, at one time. You can spread it out. And it's also important to make sure that your muscle mass stays high because again, those who are the most severely affected tend to have a lower muscle mass. So maintaining our muscle mass is also really important with exercise during cancer and cancer treatment.
That's very interesting. Thank you. And nice to know too, sometimes 150 minutes or even 300 minutes especially could sound really daunting, but knowing you can kind of break it up and aim for that, right? If you can't get there,
Yeah.
that's okay too, but getting your heart rate up is the important thing, right?
Yes. And I will say, I know it can be daunting. And so don't feel too like, if you don't exercise 150 minutes a week, it doesn't all of a sudden mean today you need to work out 150 minutes a week of exercise. Build your way up to that. So like I say to a lot of my clients a lot of times, because some of them are a lot older and, walking to the end of the block is a lot. So I'm like, well, maybe we walk a block and a half today. And then we walk back and and then as you get better, we just try to continue to push and build on that and get to that 150 minutes. You don't have to all of a sudden just do it today. And it can just be walking and doing very light movements to start with. And then eventually we progress by adding a little bit of weight, or we start to add a little bit of a speed walk in there or something. It's just showing up for yourself, really.
Absolutely, that's great. When we hear from a lot of our community members that walking was their biggest way to recover after surgery. Someone even said it felt like kind of their body parts were going back into the correct places from walking, just kind of getting everything back the way to their new normal. So
Totally, totally.
okay, great. Well, there's no other questions in the chat. Is there anything else anyone would like to ask, or Amy, is there anything else you wanted to share?
No, I think that's kind of it. I mean, if you're interested in kind of like what the protocol would typically be in terms of exercise, they say about 3 days a week of some form of weight lifting. Again, maintaining muscle mass is really important. That's what the research is starting to move towards. Before it was always aerobic. And then I would say try to get a little bit of aerobic, again, a walk in every day.
And with weight, knowing especially post-surgery, you need to be really careful lifting. Do you recommend just, using body weight or just small weights? Like, what is the recommendation there?
Well, so for everyone, it's a little different, but I would definitely suggest kind of like the exercises that I provided are a little bit more physio esque type exercises. So those are the ones you would do until you got cleared by a doctor to actually start exercising and lifting weights again. So typically keeping it kind of body weight and easier on the body is where you want to start with. And then as you get the clearance, then it is also kind of listening to your body and can so I would always suggest lift lighter to start with. And again, slowly progress as you feel better and better.
Okay, great. And someone just asked in the chat if you have a YouTube account with any of these exercises.
I don't, but you can also, I'm happy to share them and provide more like videos and stuff like that. If anyone wants them, I can send some videos for you.
Okay, great. And we do have, we will upload this video to YouTube as well. So we'll just edit it and then we'll put it up. So it should be there in the next, I would say probably late next week. And thank you, Mary Lou, just shared our YouTube channel in the chat as well. Okay, well, if there are no other questions, thank you again, Amy. This was a really great presentation, and I think very unique for our organization. So I think it was hopefully not the last. We really appreciated it. So I hope everyone enjoyed this session, and we do have quite a few educational events coming up. You can see on the screen here. Next is Economic Impact of a Cancer Diagnosis in April. That's a daytime session. We have an in-person education event in Vancouver on May 14th, and Aging, Sex Differences, and Bladder Cancer at the end of May. So you can register for all of these events on our website under Patients Upcoming Events, or you can scan the QR code on your screen, or Mary Lou will drop the direct link into the chat right now. So after this webinar, a survey will pop up in your browser. We'd love to hear your thoughts on this session and any suggestions for future presentations. So please take a minute to complete the survey. It will also come via email tomorrow through Zoom. If you need any accommodations to complete the survey, or if you have any additional questions or comments, you're always welcome to call us at 1-866-674-8889 or email info@bladdercancercanada.org. And another great way to get moving is to join us at Canada Walks for Bladder Cancer. We're celebrating 15 years and we hope you will join us. For 15 years, participants and supporters have helped improve the lives of those affected by bladder cancer by raising $3.2 million for research and support programs with the goal of improving outcomes for every bladder cancer patient. So support the work that Bladder Cancer Canada does and help raise awareness of bladder cancer by getting involved today. You can register, volunteer, or donate. Everything makes a difference. Visit bccwalk.ca to learn more. So thank you again, Amy, for this great interactive session, and thank you everyone who attended. I hope you have a great night.